tonight.
This segment is sponsored by Granger Medical. Utah's elevation means we get a high rate of exposure to the sun, and that means your risk of skin cancer goes up.
Now, we have some of the highest rates here in Utah, but thankfully, to great treatment, we have some options available for us.
Yes, and here with us today is Dr. Michael Hinckley, a board-certified dermatologist. So, Dr. Hinckley, what are some of the warning signs? What are we looking for?
Well, we talk a lot about prevention, which is key, but as you mentioned, detection is also very crucial. So, what we typically do is we break skin cancer into two primary categories, melanoma and non-melanoma. Melanomas, as a lot of people know, are dark, irregular-looking moles. Non-melanoma are more subtle, pink, purple, sometimes even skin-colored. They might bleed spontaneously, but those are kind of basic ways of grouping those two.
Okay.
So can I use an example then? Like, for instance, I know that, okay, can you see this?
Well, you got a few here. No, you're fine.
I do,
no,
but
lean
look,
in. Take all the space you need.
I don't know if y'all can see this or not, but see that thing right there? And what it'll do is it'll kind of, like, I'll scratch on it, and then it'll, and then I just kind of scratch it till it bleeds, and then it goes away. Is that the right treatment?
That's what we call an age spot. So that's
oh, it is? That's not cancer? I'm all right?
That is not cancer.
It's just
You're
age,
good.
Dave. Don't worry.
So yeah, all you have there is an old
Same thing with
spot.
these things over here, right?
So kind of brown we're not so worried about. Blackish or pinkish spots, those are general categories that we're looking at.
Okay, that's weird that you would get that at age 40.
Well, I know, we're 25, who knew? Okay, so, and you have extra training, which for these procedures, you should always go to someone with like the extra training,
Well,
right?
yeah, depending on what type of skin cancer you have and where it is on your body, then we will sometimes do something called Mohs surgery. And there are a handful of us in the community who have done an extra year of surgical training or specialty training in this Mohs technique. And you don't need that everywhere, but sensitive areas like the face, for example, where we want to minimize scarring, that's where we will often use it. But there are other areas on the body we can also use it.
I mean, your face for radio, you got to say
Exactly,
we need to keep
this thing has to be perfect.
Exactly. And the advantage of this Mohs technique, and again, not always necessary, but when we use it, it's nice because what we do is we just remove a little bit around the cancer, check it in our lab while the patient waits, and if we have to go back and take a little more, we can. But the advantage there is it gives us the highest cure rate and the ability to potentially take less of the normal tissue, thus resulting in a smaller scar.
Now, I don't know if we talked about this, but I had this procedure done a couple years ago on my leg.
Yes.
So I went in, they found a spot, thought it looked a little iffy.
Right.
So I went up and had the Mohs procedure done, which a lot of people think it's moles. It's Mohs, it's different.
Correct.
And they only had to do the, is it just like one layer at a time?
One layer,
saying?
yes.
One time, so I was lucky they didn't have to go too deep. But my scar is, I mean, you can't even tell.
Yeah, and that is a great thing about it. Most people heal beautifully, and this procedure historically has not been real well known, but it's getting better known. People like Laura Bush, Hugh Jackman, who are speaking about it. It's
right up there with Hugh Jackman, too.
Yeah, it's becoming more and more known. And so, yes, there are certain areas, and sometimes on the legs, hands, feet, face, scalp, neck, these areas will often use that technique.
Is there itching involved or any pain? Is that what's kind of strange about
question.
skin cancer?
Most of the time not. Occasionally there will be a little bit of pain, but most of the time there are not symptoms associated with it.
Yeah.
There can be some bleeding, as I mentioned, in some people, but it's usually how they look. And so, yes, you want to be checking yourself at home, but also if there's any question, you want to see a dermatologist or someone, a professional who really is familiar with this.
Yeah, so where can people go to get more information on it then?
Well, so of course you can look up pictures online, but it's better to go in person to a doctor. Lots of great dermatologists in this valley. Like I said, a few of us who have done the extra year of specialty training. Granger Medical, where I work, we have multiple locations throughout the valley. I work in Salt Lake, West Valley, and Riverton. So there are a lot of places where you can get checked out.
So WebMD doesn't have all the answers then?
You know, internet's not bad.
Make sure we call Dr. Hinckley.
It's good to see someone in person.
Okay, perfect. Thank you so much.
Thank you.
Hey, coming up next.